Hi there, my name is Eduardo. This is my third video. This is for the intranasal Viva the MAD device. I don't have a MAD device today, so I will simulate with this orange syringe that I have. Sorry. So first off, we would gather all our equipment, and then for the first steps would be grabbing what we could. If we have gloves available, we would have sanitizer, or we could wash our hands, the emergency medication order, the MAD administrator, a syringe, all those sort of types of things that we need, and the ampule of Midas. Today I don't obviously have that MAD device, so I'll be simulating it with an orange syringe. First steps are first. I pre-washed my hands, and I've also gloved up, which would good for hygiene. Then after we've done this step, we would check the administration order, making sure that this is Frederick John Brown, that the date of birth matches the 1st of the 4th of 92. There's clear instruction of when we should be giving it, and obviously when we don't give it. This is for a seizure that's lasted for more than 5 minutes. If he's hit his head, is when we should not be giving midazolam. When Frederick could be given another dose of midazolam after this one would be if he has another seizure after 4 hours. We need to call an ambulance as soon as the seizure starts. So after that 5 minutes, if the seizures haven't stopped, we would administer midazolam. But before we do that, we would check that this is Frederick John Brown. We would check that the ampule, the label matches his name. Also the date of birth, checking the expiry dates, making the expiry dates are all in date, and that all the correct information from the bottle is all good to give. So he was to be given 5 micrograms, which is one mil of midazolam. The way we do this is we would draw up the midazolam with the syringe. To the 1 mils, so that way we have the right amount. So we would draw it up to 1 mil. We'll draw it up to 1 mil. And after this, we would attach the MAD device, which will then be going on her nostril. The tip of it goes obviously in, obviously not trying to force too much in there, just a slight bit. Once administering it, we would then put her in the recovery position. The medication could take 2 to 3 minutes, or a little bit longer, just to stop the seizures. In that time, she would obviously already be in the recovery position. Sorry about that. We would monitor her breathing. We would document everything we can for the paramedics to come and know what has caused this and what we have done. We would also make sure that we have discarded the leftover of the midazolam accordingly. Obviously, per the order, we had rung the ambulance beforehand, so we would just be waiting until the ambulance officers get here, and while that happens, we just monitor and keep monitoring, making sure that breathing's okay and that there is no risk to her while we wait. After that, we would rinse all our equipment and clean up any spillages or any leftovers from doing this administration of midazolam. Thank you.